Find hope. That's what many of us strive to find in these challenging times. This is why mental health advocate Mind You, together with the Department of Health, is bringing back the annual National Mental Health Summit with the same theme of finding hope. And to get a glimpse of what's in store for us in this exciting event, we'll be speaking to DOH Representative Dr. Beverly and Mind You CEO Yuri Marshall. Good morning. Doc Beverly, it's great to have you. Yuri, good day. How are you?
Morning, Paolo.
Very, very good. Good morning.
Yuri.
It's great to have you guys back. Now, you have a very interesting theme for this year's summit, Find Hope. As we said, finding hope really is such a great way to put it for those of us who we all need a little bit of attention when it comes to our mental health. Let's talk about that theme.
Yeah, sure. So Find Hope, it was a theme that we really wanted to convey. It was a message for the country, because this year's summit really is for the people. Last year, we had a summit, and it was mainly for stakeholders so that we can have a platform to discuss the state of mental health. This year, we really wanted to open it up just to the average person, the average Filipino that wants to explore their mental health through various means. So it doesn't necessarily have to be mental health. It can be through their physical health. It can be through meditation and behavioral health. It could be through financial stress, discovering how does that affect your mental health on a daily basis. So finding hope in all of these different ways is really the central message that we want to convey for this year's summit.
Right, Doc Beverly, I think people have really sort of felt the strain of the pandemic. It's been a couple of years. We're slowly coming out of it, but there's no denying that really now more than ever, we need to pay attention to this, right?
Definitely. We also did receive the latest report coming from the Young Adult Fertility Survey, which was done in 2021, 8 years after the 2013 survey was done. And it's really quite alarming. Again, the data shows that young people, so 15 to 24 years old, 17% of those who were surveyed actually had suicidal ideation, for example, and out of those, 40% of them acted on that ideation. It means they even attempted it. So we're really not talking just about destigmatizing mental health, but really making sure that services, counseling services, and even regular people around young people, so family members, friends, how all of us can actually have a role in the mental health of the people around us.
Right. I think that sense of hopelessness really comes from the fact that it's not open to discussion, and we need to normalize that discussion. What will be some of the highlights for this year, and how is it going to be different from the previous summit? What's going to be changing this year? Yuri?
I think the really exciting changes this year is we're inviting a lot of speakers from different areas of behavioral health, and that affects your mental health. So for example, we have Dr. Candy Dalman from Centro Holistico talking about gut health and how that affects your mental health. Then we've got Bel Mapa, who's going to be talking about creative journaling and how, that art and creativity is a form of healing. We've got, Senator Risa coming back to talk about the state of mental health in the Philippines. Doc Bev's going to be there. Looking forward to that. We're going to be announcing some programs that we're working with the Department of Health. And so there's going to be a wide range of speakers. Master classes will be at the summit. So if you wanted to actually have an experiential awareness and learn, how does that type of education affect your mental health? There's going to be a large slate of activities available for the public.
It sounds like it's going to be fantastic. On the subject of amplifying your reach, how are we going to go about that, Doc Bev?
Well, definitely, the DOH uses many of its platforms, social media platforms, to get to our audience. But likewise, we do have programs in cooperation with the Department of Education on school health, as well as with the local government units in implementing our playbook on mental health. So these are our on-the-ground channel on top of above-the-line or social media channels.
Right. Well, given the fact that it's a bit of a challenge in terms of accessing mental health services, one of the interesting things that you're going to be developing or have developed for this year is to launch mental health apps. Who wants to talk about that? Yuri, perhaps?
Yeah, sure. So, we've been developing more nationwide reaching resources. Mind You has their app coming out later in the year. And so that's going to have a lot of resources, the ability to book a licensed therapy session with a licensed psychologist. And then we'll have other access to other types of modalities of healing. And so I don't necessarily want to just promote our app. There's other mental health providers out there that have other resources. They have their own apps. And I really want to have a shout out to everyone in the industry that's really making a movement, because we have to do this together. This is healthcare. This is mental health care. So we have to do this as a team.
Right. And on that idea, when you said you don't necessarily have to use this particular, or you're not pushing this particular app, there are many different resources and many different pathways, as we're seeing from the way this subject is being tackled, from physical health to emotional health, and how that all ties in with your mental health and makes us, whole. So what can the audience gain from attending this year's Mental Health Summit? What do we want people to come away with?
I think it's important
It's largely
for
the awareness
people to
and education. You go ahead, Doc Bev.
Sorry. So I think it's important for people to go in and learn new knowledge and skills about mental health. So it really depends what their baseline would be. But definitely we want at least those who are experiencing their own mental health challenges to get to know people who have overcome it, or overcoming it, and really find hope, so to speak, in these personal experiences. But as Yuri has mentioned, there are also sessions to allow people to have a masterclass, or learn skills that they can bring home with them, apply it to their own lives, or how they would be taking care of people around them. So it's really a practical session that we hope more people will get to learn about.
Right, or maybe
Mental
even
health.
just the idea, I think, of people who may not feel like, I don't have a pressing mental health issue problem, but I think just the idea of opening yourself up to making wherever you're at, your baseline, better. There are different pathways to do that. You don't necessarily have to feel distress to actually improve your mental health. Am I on something here, Yuri?
Yeah, preventative is the approach. If we're talking about how to serve a nation, we have to learn how to prevent ourselves from getting to a state where it's an emergency state. And so I'm speaking very plainly, because for anyone that's listening and isn't so knowledgeable or has a stigma with mental health, this type of summit is going to help you just optimize your state of mind, your state of being, your physical health even. And so I agree with you, Paolo. It's very important to be aware of being in that optimal state.
Right. Well, there you go. Lots to learn, lots to look forward to. Thank you for joining us today, DOH Representative Dr. Beverly Ho, and Mind You CEO Yuri Marshall. Always a pleasure, guys.